Healthy adult bones are strong enough to withstand normal forces without breaking. In contrast, a child's growing bones have more collagen, making them more flexible. Typically, a child's bones crack on only one side, and greenstick fractures are most common. Both greenstick bone fractures and hairline fractures are called incomplete fractures. A greenstick fracture is an incomplete one in which the bone bends and fractures only in the outer arc of the bend. A hairline or stress fracture is an incomplete fracture that is the result of repeated trauma over time. It causes small cracks that appear like thin lines on an X-ray image. In contrast, a complete fracture is a break that goes through the full thickness of the bone. Adults' bones that are affected with such diseases as osteoporosis or cancer cannot withstand normal forces and will break more easily. These breaks are called pathologic fractures and are more likely to be complete. The direction and type of force will determine the fracture's pattern. A transverse fracture occurs straight across the width of a bone. An oblique fracture occurs at an oblique angle. A spiral fracture winds around the circumference of the bone. A comminuted fracture breaks the bone into two or more pieces. A compression fracture usually occurs in the vertebra, causing the bone to collapse. A complicated fracture involves injury to nerves, blood vessels, or other soft tissues. An impact fracture occurs when one section of a fragmented bone wedges into the next one. In a closed fracture, the bone does not break the skin. In an open or compound fracture, the skin is broken, and a piece of broken bone pierces the skin. These fractures are susceptible to bone infection. Before a fracture can properly heal, a procedure called reduction places the ends of the bones back into normal alignment if the fracture has caused them to become misaligned.